This is Dr. Robert S. Brown. I'm a psychiatrist at Fort Lee, where I've had the honor of working with soldiers for the last 5 years. All of my patients are combat-hardened soldiers who are dealing with the psychological and physiological consequences of warfare. Today we're going to be talking about how to understand and how to manage the exaggerated startle response. I want to begin with two stories. Several years ago, following a group therapy meeting, the soldiers went outside in the parking lot and began chatting about the things that were going on in the group. All of a sudden, there was a 21-gun salute in a nearby parade field. The soldiers had not expected it. It sounded like an incoming attack of mortar fire or propelled grenades. The soldiers had an exaggerated startle response. One of them jumped under the truck that was parked. Another jumped into his vehicle and drove off rapidly. And in a matter of a few minutes, they realized that it was no more than a cannon fire. But they were upset, some of them, for a long period of time following this experience. This is a dramatic example of the exaggerated startle response. Another story. One of my soldiers was having dinner in a restaurant with his wife and children. Someone dropped a tray. It was a loud, clashing, unexpected noise. He turned the table over, shouted incoming, and drove to the floor under the table. Of course, he was extremely embarrassed. He immediately took his family and left the restaurant. This is also another example of the exaggerated startle response. What is the exaggerated startle response? To understand that, we have to understand something about the nature of hearing. As far as we can tell, the sense of hearing begins before the child is born. The first sound that the child has is the beating of the mother's heart while the child is being carried in the mother's uterus. Some companies actually make toys that allow the children to have something like the mother's heartbeat in a toy that they can listen to as they fall asleep at night. Now, the sense of sound is a very important sense for us. It allows us to enjoy each other's voices, to enjoy music, to be informed when danger is around. And most of the time, the sense of sound works on an unconscious, automatic level. As a matter of fact, all the information that goes to the brain comes from our senses. And the sense of sound is a very important sense for combat soldiers, because they can run to a bunker or to a shelter if they can hear the incoming bomb or mortar on its way to do destruction, and they can run to shelter and be saved. Of course, the eardrum is like a drum itself, and the top of the drum is stretched very tightly, so that even slight sounds causes the body to have a tremendously strong reaction to that sound. We call this the exaggerated startle response. It comes when an unexpected, loud noise, especially a noise that reminds the soldier of combat. Now, it's a perfectly normal reaction, but it seems to be divided into at least 3 parts. And the purpose of this presentation today is to help each soldier understand these 3 parts in such a way they can begin to manage their reaction to the startle response. First of all, it is a response. It is very similar to a doctor tapping your knee, and your knee is going to respond with a jerk, no matter whether you want it to or not. You can intentionally hold back the response to a degree, but it is a reflex or response. So when the noise comes in, the eardrum, pulled very tautly and tight, begins to respond with a nerve that goes immediately to your muscles, and it makes you want to look for shelter and safety. Now this is perfectly normal, and it is life-saving in combat. So the first part of this response is the body's reaction to the unexpected, loud, usually loud noise, and the noise has kind of vibrations that are similar to the sounds of warfare. The second response to the startle response is usually anger or irritability. So first there is a loud noise, an attempt to escape, and then there's anger. It's as if someone is trying to frighten you, and then you turn around and say, "Why did you do that?" and you get very mad. The third part is one of shame and embarrassment. If you're in a public place and you turn a table over or you jump under a truck and people see this, it's very embarrassing. But as some soldiers have taught me recently, if they're completely alone in their home, they will have only the first two parts. They will hear the loud noise, have the exaggerated startle response, look for cover, but and have anger, but they have no shame and no embarrassment because no one sees their reaction to this situation. So let me review what I've said so far. The startle response is first of all a reflex. It is a reflex to an unexpected, loud, but somewhat familiar noise that reminds the soldier of warfare. The second part of it is usually almost always anger. And the third part, if others are around to watch it, is shame or embarrassment. Well, how can somebody begin to understand this in such a way that they don't have all the excessive or exaggerated response to the loud noise? First is understanding that it's normal. Second, that it's not dangerous. Third, it will go away if you don't pay too much attention to it. Fourth, over a period of time, it will completely subside, and you will have only a very minor reaction to it. It is a normal, healthy response to a loud, unexpected noise for soldiers who have been in combat. Let me review again what I've said. No matter what situation you're in, if you've been in combat, you have heard these incoming dangerous weapons that have caused a lot of destruction. Even now in a safe environment, or environment that appears to be safe, the loud, unexpected noise that's similar to warfare noise will cause the body to respond and look for safety and shelter. And it will be an immediate reflex over which the person initially has almost no control. It'll be followed by anger and then embarrassment if someone's around to see the reaction. Paradoxically, the more startle response situations you can have, the better off you're going to be, because you realize they're harmless and they're going to go away. These are one of the consequences of warfare. Try not to be upset by it, understand it, and you will soon master your exaggerated startle response. Here are some of the questions that soldiers have raised about how to deal with the exaggerated startle response. Let me say in the beginning, and this is a preface to all questions you can have about this topic, we want to tone down the level of anxiety that you have in general. The startle response is a normal response that everyone has. Soldiers have an exaggerated one because their nervous system is keyed up and they're on edge all the time, and anything you can do to bring down the anxiety level, the tension level, the stress level is going to also bring down the startle response to a more acceptable range. Now, I would suggest that you work out a system that seems to be natural and normal for you in dealing with this. Part one is the noise. You might say, well, what can I possibly do if a noise happens that's totally out of the blue and unexpected? I would say that's the very first time you should stop whatever you're doing and try to breathe deeply and slowly while you're counting from 1 to 10. Breathe deeply and slowly and count from 1 to 10. The second part is the anger. The anger is natural, but bring it down to an acceptable range. Here, by leaving the situation, walking away from it calmly and quietly, and recognizing that you are exactly like every other soldier in this regard. The other part is the shame and embarrassment. Actually, the public understands that you are our heroes. You have put your life on the line for the country. They're not going to be critical of you. They're not going to be causing you to have a sense of shame. they are understanding and accepting of you. So you need to simply chalk it up to being a good soldier. You are being, in fact, a very good soldier when you respond to stress in this manner. The question about what can the family do to help with the startle response is a very important question. I know a lot of soldiers don't like to talk to their families about what they've been through. One soldier told me that he's told his children that what he suffers from is the injuries of war. Now his little girl, 3 years of age, she can't see the injury, but she knows that something is wrong with her daddy because of war. And she has accepted that his behavior is due to the war that he went through. But it is good if families can have situations that are not as noisy as normal. If there are toys that are making loud, unexpected sounds, I try to minimize those, especially when the soldier first gets home. The families can understand by not trying to ask repeatedly, how are you doing? What can I do to help? Please tell me, I want to be of help. Soldiers want to be left alone. They don't want a lot of questions asked. They want to be accepted and loved, but don't grill them. Don't try to make them face what it is that they're not ready to face. I think they will appreciate that, and you will find they will begin to fit in a more normal way over a period of time. As you know, since you're under my care, almost all of you, you can call me on my cell phone anytime you have an exaggerated startle response, and we can discuss it right on the spot, and maybe that will be of help to you.